You may have seen one or two people collapse before and wondering what is responsible for this. Why do they collapse? All right, before we look into that, let's quickly define the word collapse. In clinical medicine, collapse refers to a rapid loss of postural tone or consciousness that may or may not include fainting. Yes, you lose your postural tone, you lose consciousness, but it might not just be because of fainting, might not include fainting. But having known that, before we go into why do these things happen, what is responsible, I want us to quickly do one small exercise. I want to ask you, sincerely, do you want this video to get to so many people who might benefit from it? Would you want people, your family, your friends, and all that to keep getting the benefit you are getting from this channel? If your answer is yes, have you subscribed to this channel? If you have not, why not hit the subscribe button and subscribe immediately? And remember that whatever action you take now will help this channel either to grow or not to grow. So go ahead, subscribe, and then let's progress. Now, having known that collapse in medicine is simply loss of tone and consciousness, why do they happen? There are classifications as to the causes of this issue. We're going to look at them one after the other. The first one is what we call syncope, which is true fainting. Syncope is defined as a brief loss of consciousness with spontaneous recovery caused by a temporary reduction in cerebral blood flow. So if there is a little reduction or spontaneous reduction of blood supply to your brain, the brain will react because of the reduced perfusion to the brain, and then you could lose consciousness. You could collapse or faint. All right. But at this point, we're going to be looking under this syncope. What are the other things that can be responsible? Number one is what is neurally mediated. In this place, we look at the reflex or vasovagal action. Okay. Most frequent type of syncope are triggered by pain. By pain, emotional stress, prolonged standing, or sight of blood. Yes, if you have severe pain, you could actually eventually faint or lose or go into some level of collapse, even if it is brief or small. Then if you are passing through a lot of emotional stress, this could also happen. And then sometimes if you stand for too long because of some gravitational pull, you could also have this small event. But there are some people who don't like to see blood at all. The moment they see blood, either from someone else or from themselves, they just suddenly lose consciousness or they suddenly collapse. And this collapse may be brief, but they actually drop to the ground. So that is one of the reasons why people suffer this under the neurally mediated events. Then we also have the autonomic reflex. The sudden drop in your heart rate and blood pressure can reduce blood supply to your brain, and then you suffer some collapse. Then the other factor under this is orthostatic hypotension. Orthostatic hypotension happens when you suddenly stand up. Yes, you suddenly stand up and your blood pressure drops. And this is common in elderly or in people who are taking antihypertensive drugs. So you are taking antihypertensive drug and you know the main reason why this could happen. In antihypertensive drugs, some of these drugs will dilate your blood pressure, your blood vessels. And when they dilate your blood vessels, the blood supply to your brain could momentarily drop, and this could result in this. So that is why if you are on antihypertensive drug, it is advisable sometimes that you wake up from the bed, you don't just stand up immediately. You sit up for a few seconds, to allow the brain to balance the blood supply to it, and then you can now walk normally. But in some cases, if you do not observe this and you just stand up, you could actually fall. So that is orthostatic hypotension. Then, in some cases too, another cause is what we call unusual autonomic disorder. Yes, unusual autonomic disorder. And one of those is the postural orthostatic tachycardia syndrome. Yeah, this can cause near syncope or collapse with standing due to autonomic dysregulation. So your autonomic system has some imbalance. So if you do not take care when you stand up, this could make you also fall. Then the number two reason why this is happening is because of hidden cardiac causes. Yes, when we say hidden cardiac causes, there are things that are hidden within your heart that could also lead to you suffering this situation. And so, number one is arrhythmias. Yes, arrhythmias are electrical instability. Your system has its own electrical discharge. The heart has its spontaneous electrical discharge that controls the movement of blood or whatever. But if you have arrhythmias, you will be having abnormal heart rhythms. So this could either be slow or fast, either slow or fast. And because of these abnormalities, there may be sudden reduction in your cardiac output and cerebral perfusion, causing collapse without prior warning. So if there is a sudden pool of blood, a sudden change, you could just collapse, and you may not have had any warning before this happens at all. Then there's also the ventricular arrhythmias that can be lethal. Ventricular arrhythmia can be very dangerous. Yes, these arrhythmias can cause problems that you do not expect at all. And in some cases, you can't predict the outcome. Then under that, we have the subclinical structural heart abnormalities. Yeah, recent research have revealed that there are hidden microabnormalities. Yeah, hidden microabnormalities in your heart tissue, otherwise known as tiny fibrotic spots. They are not detected by routine ECGs or echo, but can trigger catastrophic arrhythmias in athletes and seemingly healthy adults. So if this exists in your system, can cause problem. Then you also have inherited electrical disorders. Yes, in families where these are common, it will not be out of place to see people who come from that family to be having such issue from time to time. The number three reason is what we call neurological and other hidden parts. Number one among them is seizures. Yes, generalized or focal seizures can cause sudden fall or loss of awareness. You may have seen people who suffer from epilepsy or other forms of seizures. And so in this case, it's either it is generalized or focal. And this could also bring about somebody suddenly collapsing. But there could also be another reason, which is the transient ischemic attack, otherwise known as the TIA or stroke. A sudden focal neurological deficit from compromised brain. The compromised brain blood flow can also lead to this issue. Of course, you know that the brain requires constant blood supply to be able to function effectively. So if there's any disruption in this blood flow because of a blockage in the vessels supplying the brain, you could suffer from TIA or you could suffer from stroke, and this also lead the individual to collapse. Then another one is what they call the drop attack. The drop attack is a sudden fall without loss of consciousness. So you fall suddenly, but you do not lose consciousness. And it is caused by transient loss of postural control due to vestibular and that refers to the ear anyway, hemodynamic or neurological dysfunction. If there's any dysfunction in your nerves and or anything, any shake in your ears, your inner ears, so that could also bring about this problem. Then the next one is the metabolic or endocrine contributors, metabolic or endocrine factors. So, for instance, the hypoglycemic or low blood sugar situations. Somebody, for instance, who is suffering from diabetes, if for any reasons your blood sugar drops, you could suffer from this. And why should your blood sugar drop? If you take insulin, for instance, or you take other drugs that are meant to control your blood sugar, and you did not eat, this could bring about a reduction in your blood sugar. And if you are performing activities, either indoors or outdoors, it would actually make you to collapse. At this point, I want to ask again, are you subscribed to this channel? If not, please hit the subscribe button and make sure that you keep getting a notification when new videos are published. So, if you have found this video useful to this point, kindly give us a thumbs up. Let us know that our videos are helpful to you, so that it will keep encouraging us to keep developing more and more useful videos like this. All right, let's continue. So, apart from hypoglycemia, which is reduction in your blood sugar, another reason why you could also suffer from collapse is because of severe dehydration or electrolyte imbalance. Yes, you know that the body requires water to keep functioning optimally. But if for any reason your level of water in the body drops significantly, this can make you to collapse. Yeah, because at the same time your blood pressure will go down. So because of that, you could collapse. And most times it's common in hot climates or in people who are taking diuretics. Yeah, diuretics are those who are maybe hypertensive and they want you to reduce your sodium and whatever fluid level in your system. They can give you some diuretics, and as you do that, you keep peeing, and if you are not careful, it could actually make you to become dehydrated, and then you could suffer from collapse. Then the other reason also under this is as a result of anemia. And of course, you know that anemia is a reduction in oxygen carrying capacity of the blood. And when oxygen is not fully distributed to the brain and other vital organs, you could also suffer momentarily from collapse. So there are other rare factors that are not too common. Like one of them is the pulmonary embolism, which is a clot in the lungs. So if this happens, it could actually reduce the heart output and oxygenation, and this will eventually lead to collapse also. So having known all this, what do you do? Yes, we know that syncope is harmless most of the times, though common, it may signal serious disease. All right, what do you do at this point? Make sure that you are monitoring your blood pressure if you are hypertensive. Make sure you are taking your medication the way it is prescribed by the doctor. Do not for any reason increase your medication just because you want to achieve a purpose. Maybe you are going to for an interview and you feel that if they know that you have high blood pressure, they're not going to accept you. And for that reason, you decide, okay, let me be smart. Instead of taking one tablet, you take like 2 or 3 tablets. You could actually collapse. That same thing you want to avoid might happen to you in your interview class or in your interview hall. Maybe you want to stand up and you suddenly drop. So don't be smart when it comes to such medications. Always make sure you take what exactly the doctor asked you to take, and don't do that which might put your health in danger. So above all, always see your doctor. If for any reason you have suffered from any form of syncope or you have a family history like that, make sure that your doctor is aware, so that if they have any special advice to give to you, the doctor will always give to you. So for any reason, do not suffer yourself. Do not suffer any form of dehydration. Keep rehydrating when it is necessary. And every other thing that you have seen here that is partly responsible for collapsing, make sure that you put them into notice and avoid them. So thank you. See you once again in my next video. Remember to share this video to your friends if you find it helpful. God bless you. Have a great day.